Ballad Health's again reported a new record number of hospitalized COVID-19 patients on this Monday. The health system said 454 patients are currently being treated for the virus in their hospitals today. That's 4 more than the previous high set last Tuesday. 90 of those patients are in intensive care and 67 patients are on ventilators. And at the Niswonger Children's Hospital, 6 pediatric COVID-19 patients on this Monday. And joining us this evening on the news is Ballad Health's Chief Infection Prevention Officer, Jamie Swift, a go-to resource for us. Jamie, thank you so much for your time, your reaction to some new record numbers. What does the public need to understand about those numbers tonight?
Yeah, obviously it's a concern when we have numbers that high. We're going to see strain on our staff and strain on the hospital system, certainly on the EDs. But we also want the public to understand we think some of that number may be some weekend backlog of discharges, not always being able to get patients into long-term care. So we're certainly still seeing admissions with COVID, and it's still a burden in the community. But we also think this number that, we're not as concerned that it's all new sick people, that truly maybe that we're just holding some, that hopefully through the week we'll be able to start seeing our discharges catch up. Let's
touch on something you mentioned, long-term care. That is for many where they have to end up going after, especially I would think, is stay in ICU. What is that? How does that, why is long-term care a part of this picture for so many?
And, we have our case managers who work really from day one if we think we're going to have that discharge planning process. And so they have to work closely with our long-term cares. Long-term cares are under those CMS guidelines regarding COVID and what they can take and what they can't. And so we work closely with our partners. We try to get patients into the long-term care setting that are appropriate just as quickly as possible. It is an ongoing challenge to make that happen.
I guess my point is it's because they're just so weak. They need help to rehab, right? Many of them have to learn to do a lot of key things again, right? After what they've been through.
Absolutely. If you've not been in the hospital for a long time, you may not realize how quickly your body deconditions. Your muscles can get very weak, especially if you've been on a ventilator, a paralytics. There's a lot of relearning that has to happen, sometimes even after a short hospital stay. So, long-term care, rehab, that very much is a key part of recovery for many of our COVID patients.
I would think so, and I've heard that to be the case. Let's go back to what you're seeing, which is that a week ago when we spoke, you said, I'm hopeful we see at least a plateau, if not the peak, and we start to see those new cases drop. Sounds to me like that's what you are seeing tonight. What do you think that means in terms of long-term with the Omicron variant?
I really do think we peaked with Omicron. Our daily case counts as far as new cases is coming down. We are down significantly from where we were a few weeks ago. So I think we're past the peak. I think our hospitalizations will catch up. There's a lot of questions on the horizon. We don't expect to come down as quickly as we increased. There's also the concern of if this BA2 variant comes in as we're going down, is that going to cause another little bump? In cases it could. There's just a lot of unknowns, but we are certainly not seeing the record number of cases per day that we were seeing just a few weeks ago.
Golly, for about maybe a year and a half now, we've been hearing from you, as long as there's been a vaccine, that there was proof that you saw that made you believe a vaccine was and is the best defense against, if not getting COVID-19, getting hospitalized with COVID complications. Based on what you're seeing, as we're now seeing, maybe hopefully we're going down on the surge of this variant, do you still believe that the vaccine and the booster remain effective against COVID-19 for hospitalization prevention?
Absolutely. The vaccine works, the boosters work. There's study after study. We see it in our own patients beyond just the national studies that, really if you're hospitalized, you're less likely to have been vaccinated. And so what we know is that vaccine, that booster really is keeping patients out of the hospital. It's keeping them out of ICU. We see it all the time. We see the difference in the course progression, how people can recover at home versus having to come in for supportive care.
Jamie, headline today from federal numbers, 900,000 COVID cases in our country today. This is a weird question. You're used to that from me. Did you ever think we'd be where we are today 2 years ago?
Hard question. Not really. It's, that the 900,000 deaths is staggering. And I know when a number is that large, people can detach from it. And so I look right here in our community, and we have lost so many people in our community. And now that this is truly becoming a vaccine preventable, if not illness, at least a vaccine preventable hospitalization and severe course of illness disease, it's heartbreaking. That is one of the most emotional tools that I carry and that our healthcare workers carry, is that there's so much pain and grief and death, and it's a lot to carry. And so I'm hopeful that we can somehow come out of this and work together as a community to really get past this pandemic.
No way to measure the loss and the impact in numbers, for sure. Jamie Swift at Ballot Health. Thank you, Jamie. We appreciate it. Thanks for your perspective as always. Thank you.